number of measles cases in this country has grown to 522, 400 of them in Texas.
Texas Department of Health announcing 17 new cases in the last 4 days, pushing the total over 650. Measles is still spreading.
Your skin is itching, burning, covered in red spots, and panic sets in. Could this rash be just an irritation, or is it something far worse? In some cities in Texas, measles rashes are skyrocketing as vaccinations plummet, turning a once rare disease into an urgent crisis. And today, we're uncovering the truth behind the most common rashes we see in urgent care, and which ones demand immediate attention. Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel, and to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it. Now, let's break this down the way we do in clinic, case by case. We'll talk about 3 patients, 3 rashes, all very different, but every one of them shows up in urgent care week after week. First up, we've got Mason. He's 5, and this is the 3rd time his mom has brought him in this year. She's worried his skin is infected, his arms are cracked and bleeding again. This is classic eczema, also known as atopic dermatitis. It's not just dry skin, it's an allergic skin condition tied to asthma, seasonal allergies, and food sensitivities. When the skin barrier breaks down, bacteria move in, and that's when we start talking about antibiotics. But the core of treatment, moisture and barrier repair. Here's what I tell parents. Skip the scented lotions. Use thick ointments, petroleum jelly or Aquaphor, immediately after bathing. And if it's flaring, that's when we pull out low to mid-potency steroid creams. But we'll get into those options a bit more later in the video. Now let's talk about Marcus. He just got back from a weekend camping trip with friends. 2 days later, linear blisters up his arms, across his legs. He swears he didn't touch anything unusual, but we know better. This is a textbook case of poison oak. But here's the real culprit, something called urushiol, the toxic oil found in poison oak, poison ivy, and poison sumac. Now, if you're sensitive to one, you're sensitive to all of them. And here's what most people don't realize. That oil can linger for days on your clothes, on your dog's fur, your backpack, basically anything it touches. If you think you've been exposed, you've got about 15 to 20 minutes to wash the area thoroughly with soap, preferably dish soap, not body wash, to break down the oil. After that, your immune system kicks in and the itching begins. We treat it with steroids, topical or oral, depending on severity, and antihistamines to help with the itching. We'll cover the urgent care treatment options more later. Now, Vanessa is a high school teacher. She came in complaining of burning pain on her right side that started about 3 days ago. She thought she had pulled a muscle while moving desks around in her classroom. And here's the twist. Yesterday, pain got worse and a rash popped up. That's when she got worried. What we saw was a classic presentation. Small, clustered blisters following a single dermatome. Pain came first, then the rash followed. The diagnosis, shingles, also known as herpes zoster. Now, it's actually the same exact virus that causes chickenpox. What happens is it can reactivate decades later, especially during times of stress or immune suppression. People think of shingles as something that only happens to the elderly, but we do see it in younger adults all the time, especially teachers, nurses, and parents, people under chronic stress. Vanessa hadn't gotten the shingles vaccine because at 38, she thought she was too young. But the virus doesn't care about the calendar. It cares about your immune system. The pain from the shingles isn't just surface level. It's actually nerve pain. And for some, it lingers long after the rash is gone. This is a condition called post-herpetic neuralgia. And that's why early treatment is key. Now, our last patient is Liam. He's 5 years old and just started kindergarten. His mom brought him in after 3 days of fever, runny nose, and red eyes. She thought it might be another cold, going around the classroom. But then she noticed the rash. On physical exam, we saw something classic but alarming. A flat, red, blotchy rash beginning at the hairline, spreading behind the ears and down the body. His mother eventually confirmed he hadn't received the MMR vaccine. They delayed it, thinking he was too young. It wasn't urgent. His rash was measles. And what many don't realize is just how fast and how far this virus spreads. You see, measles doesn't just linger on surfaces. It lingers in the air for hours. Measles is so contagious that if one person has it, up to 90% of the people close to them who aren't immune will get infected. In early 2025, Texas reported over 680 confirmed measles cases, mostly in unvaccinated children. Now, tragically, 2 children have already reportedly died. And these aren't kids in remote areas. They're from our neighborhoods, schools, or daycares. I'm not here to shame anyone. I'm here to tell you that measles is preventable and that the vaccine works. If your child hasn't had the MMR shot yet, please don't wait for an outbreak to happen in your school. We're seeing it now in real life, in real time, in urgent cares. You see, in medicine, we're trained to recognize patterns. And when we see this combination of rash, cough, fever, no vaccination, we have to act fast because by the time you see the rash, it's already been spreading. So when it comes to rashes, context matters. Age, history, symptoms, and exposure all help us figure out what's dangerous and what's just uncomfortable. In urgent care, it's our job to get that answer fast. Now, let's talk about what we actually do to treat these rashes in urgent care. I'll break it down clearly. What's over the counter, what needs a prescription, and what to look out for. And if you're looking for trusted over-the-counter options, I got links in the description below. You're welcome. Now with eczema, the goal is to calm inflammation and repair the skin barrier. Over-the-counter options include hydrocortisone cream for mild flares, moisturizers with ceramides like CeraVe or Eucerin, colloidal oatmeal baths like Aveeno, diphenhydramine, sedating antihistamine to help with nighttime itch. All of these are linked below in the description if you want to grab them online. Prescription options include things like triamcinolone cream. This is a mid-potency steroid. Tacrolimus or picrolimus, a non-steroidal cream for sensitive areas like the face. For poison ivy, oak, or sumac, these rashes come from urushiol oil. Early action makes a huge difference. Over-the-counter options include hydrocortisone cream, calamine lotion, or Zyrtec or Benadryl for itch relief. Prescription options include prednisone, which we reserve for severe cases, and prescription-strength steroid creams for intense inflammation. If it's blistering or covering large areas, especially the face or genitals, don't try to tough it out. That's when we go to prescription treatment. Now, shingles is a viral reactivation of chickenpox. Early treatment prevents weeks or even months of pain. In this case, there's really only prescription-only options. These would include valacyclovir or acyclovir, which are antivirals that must be started within 72 hours to be effective. Gabapentin or pregabalin, which is a nerve pain medication for the lingering nerve pain that can occur, and corticosteroids, which occasionally are used in select cases. Now, there are some over-the-counter adjuncts. Ibuprofen or acetaminophen, Tylenol, can be used for pain or fever. We also talk to patients about the shingles vaccine. If you're over 50 out there or even younger with a weak immune system, you should get the shot. Vaccination is over 90% effective at preventing shingles and postherpetic neuralgia. It's the best way to prevent this in the first place. And when it comes to measles, there is no antiviral pill. It's all about support and prevention. Supportive care includes fluids, rest, and fever reducers. Vitamin A supplementation in children, when appropriate. Strict isolation is key to prevent further spread. And the MMR vaccine remains our strongest protection. 2 doses give about 97% effectiveness for protection against measles. We've seen deadly complications in unvaccinated kids in places like Texas, unfortunately. Don't wait until there's a local outbreak to act. If you're unsure about your or your child's vaccination status, get checked today. Now, knowing which treatments work and when to seek help can make all the difference. For mild cases, I've linked some of my most trusted and most used over-the-counter products in the description below. For anything more serious, urgent care or your doctor's office is the place to be. And when it comes to measles, the best medicine is still prevention. Now remember, not all rashes are equal. Know the signs, act quickly, and don't hesitate to seek urgent care when in doubt. If you've got questions about rashes or want us to cover another urgent care mystery, comment below. And don't forget to subscribe for more life-saving tips and truths from Urgent Care Uncovered. Until next time, stay dynamic. Peace.